dry. So now what I'm gonna do is pick up my gown. And Tony's in the room, turning over the room. Now this one's folded a little different. Just pose.
After you set up the tray, do you put something over it with a sterile?
Yeah, you can put a drape over it, but if you're gonna do it immediately, you don't have to worry about it. But if there's a lot of people scurrying back and forth, you might wanna bring a set of towels in with you, sterile towels, and then you can open up those and lay one on top.
Vicky,
Mhm.
after you set up the tray, you go and scrub again?
Well, you could. I mean, usually I wouldn't scrub first. I was just trying to show you guys.
Oh, you.
But normally, you wash your hands, put on your sterile gloves, you can open the tray, then go scrub, and then put your gown and gloves.
Just FYI for some of you, depending on where you go, I know Kaiser has a different policy and procedure. Different hospitals have different regulations as far as draping things on top of open trays.
Oh, sorry.
Yeah, and so just FYI, there's I know Irvine doesn't, UC Irvine doesn't do it, and I'm pretty sure over at Anaheim they don't do it either, because I was talking to Troy about it the other day. You're not allowed to drape open trays anymore because of some idea from ARN, it was an ARN standard type thing, that says that covered trays have a higher propensity for people to contaminate because they don't see that it's an open tray. They just think, oh, it's just a tray and somebody threw a towel on top of it. So just realize that you might get different things from different people, specifically RNs that are supposedly experts in that whole sterile thing. So just realize that and take it with an open mind. But from our point, it's acceptable to go ahead and put a drape over it because you're trying to protect what you've already set up.
Yeah, because a lot of times the physicians want you to have everything open, then you go with them to get the patient, bring the patient back in, and the problem and the thinking from our perspective is that you may bump your setup tray, or people that are setting up the OR, the nurses and the scrub techs, may not see it, you know, because everybody's in a hurry, may not see it and bump it. Same as them, you know, because they have their area like way against the wall, so when they're setting up their surgical stuff, it's away from all the action. We're right dead center by the door, so wherever we set up our stuff, it's really at risk from people coming and going. And no one would do it intentionally, but, you know, this kind of thing happens and they're like, nobody saw me, you know. And here you've been really careful and your tray's contaminated. All right, so gowns. So I've scrubbed, now I come in, my gloves are there, ready to go. So this one opens a little differently, but usually it should open so you have the top edge. I forgot how to pick this one up. You have the top edge, and that's what you want. You want this top edge, and you can see that it's got these little folds here. And that's where I'm going to put my hands, because my hands are clean and sterile, and I want to keep them that way. And I grab a hold of this, and I'm letting the gown just fall away. And I step back, and right away I put this arm in this one. And you notice I don't poke my arm through, because then I can't pick up my gloves. So right now I want, even though my hands are scrubbed, they're not as sterile as my gown and my gloves on. So I don't poke my hand through the end, just enough to be able to move like this. Then the next, then Tony's over there. Well, Tony, could you tie me? So you're back to him.
Who is Tony in the OR?
Tony's the anesthesia tech. He's setting up his room.
Okay, so
Or, you
over
know,
here you'll see
anybody.
there's a little bit of a Velcro strap type thing. Sometimes there's snaps, like on the green gowns, there's little silver snaps, or sometimes there's a tie. So it depends on the gown. This one has the Velcro, so all I do is just pull it and try to choke Vicky a little bit.
Been waiting years to do that.
But you just make sure you pull it up a little bit, make it snug, and then you bring it to the furthest point there. Because the worst thing that can happen is, turn around, if I need this loose, and then this happens.
Yeah.
You don't want that, okay? So you want to pull it back, make sure that it's tight, and you bring it to the to that tightest point that you possibly can. Now, the other part is down here. there's an internal snap here, I mean, a little tie that's, it'll probably be tucked away back in here, so you're gonna have to reach around.
Familiar with your.
And you're gonna get familiar with your coworkers, because you're gonna basically reach around, grab it, and then bring it to this one. Now, this is a really simple kind of tie, you just do a simple tie.
And remember, you guys get called on a lot to do this in the OR, because you're the one that's in the room when the scrub tech is setting up. And so they'll do like I did and just say, hey, Tony, you know, come tie me.
And so when I'm done, I go, okay, Vic.
Yeah, so that means he's done with his part for the moment. So now I'm gonna come around, and unfortunately, all the gowns we have for you guys don't have these, but I want you to really pay close attention, and we'll try and fake it as best we can. I'm gonna grab this, well, actually,
I have to use
my
gloves.
gloves. Yeah. All right, I'm gonna come over.
There's 2 sets of gloves.